Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. This is our community resource section, and the guests tonight are Dr. Greg Repass and Miss Karen Harbin, who is the CEO and president of Commonwealth Credit Union.
That's right.
All right, got all that right for you. Now, you, I talked to you earlier, are an internist who was a hospitalist, went to the dark side, I said, and you're now the Chief Operating Officer of Baptist Health Lexington.
Yes,
but
sir.
You know what it's like to be in the trenches, to take care of patients, and what the importance of a facility is.
Yes, sir. Absolutely. I got my start at Baptist Health back in 2013 as a hospitalist. I was actually born in the hospital.
I was going to say, you got your start way long time ago at Baptist Health.
They've not figured out how to get rid of me yet, I guess. But yeah, so I've worked there my whole career and found my way into administration, and certainly passionate about the future.
Well, this week is the year anniversary at Hamburg. So I've looked at some numbers, but tell us about the volume and the things that have occurred out there over the last year.
Yeah. So we got our start back in April 22nd of 2024. We had a limited opening of the campus, then we did some further services in June. But we have now served over 57,000 patients campus-wide. We've done over 4,000 surgeries in our ambulatory surgery center, over 5,600 cancer patients treated in our cancer center. We have treated over 15,000 patients in our ER, and over 23,000 imaging studies have been performed.
So you've not done much.
Right.
Now, Karen, you are, the question is, okay, you're the president and CEO of Commonwealth Credit Union. What does that have to do with Baptist Health at Hamburg?
So we believe at Commonwealth Credit Union that health is the first step to wealth. So if you do not have your health, you probably will not have your wealth. Like, if you take a holistic approach, we are treating the financial well-being while Baptist Health is treating the mind, body, and spirit of a person. So our values align very well, and we feel very strongly about supporting community partners like Baptist Health.
And you were very instrumental in supporting Hamburg. Tell us some of the things that you did.
Yes, we made a big gift to Baptist Health, and not only Baptist Health Hamburg, but also Baptist Health in Richmond. And we're very proud of those gifts. I think it was the largest gift to date, and named the Educational Center at Baptist Health Hamburg. And financial education is very big for us. We are continually in schools and community groups at Baptist Health all over our market areas, and teaching financial education to those we serve.
Well, we thank you for doing that, because you provide a lot of services, and you mentioned some services at Hamburg. Give me a list.
Yeah. So the front door would, of course, be our emergency room. We offer an emergency room that's 24 hours, 7 days a week. We have imaging both to support the emergency room, as well as a lot of modalities that you can have outpatient studies on. We have a retail pharmacy there. We have an outpatient lab. We have a large ambulatory surgery center for outpatient surgeries. We have a cancer center where we have radiation therapy services, infusion services, and a specialty clinic where you can see a cancer doctor. We also have a cardiovascular lab where you can get a stress test or an echocardiogram. And then we have multiple specialty clinics with a lot of different specialists and doctors who practice out there.
But it's not actually an inpatient for it's an observe. There's a, what am I trying to say here? You could be there for 24 hours, but if you got to be there for 1, 2, 3 weeks, you probably wouldn't be at Hamburg.
That's right. So connected to the ER, we have a small observation unit. Patients typically stay there 14, 15 hours. So think of a patient that needs to be watched just a little bit longer than a normal ER stay, but may not necessarily need a hospital. Observation is the medical term of, you know what, we need to watch this patient and see, do they need a hospitalization, or can their care be managed by their family doctor when they leave the hospital? And so we do have that ability at Hamburg, but it is, the campus in its current state is an outpatient medical campus that is designed for patients to come and leave.
So if they have to be there 2 or 3 weeks, if they start out at Hamburg,
yeah,
you buy an Uber to get them to Nicholasville Road?
We hope not. So when we opened, we envisioned connecting our two main campuses So Central Baptist Hospital, now Baptist Health Lexington, opened in 1954. And we did it with community support, like Commonwealth Credit Union supported us with Baptist Health Hamburg. But both of these campuses are Baptist. And so when we opened Baptist Health Hamburg, we went and got a license to have an ambulance service. And so we run and maintain 4 ambulances. We always have a full service ambulance on site at Baptist Health Hamburg. So any patient that presents there with a stroke, with a heart attack, with a medical emergency, we're able to quickly transport over to main campus to get the kind of care they need.
And you can do everything you need. And you mentioned community, and you also mentioned community. It's important. The Commonwealth is community, but part of the community is supporting places like Baptist Health.
Right. I mean, healthcare is the foundation. Like in our communities, we must have healthcare to have a thriving community. And we knew that Baptist Health Hamburg would be on the interstate for Eastern Kentucky and so many thoroughfares that would be a great place for us to invest in and help the community thrive.
Well, we thank you all for coming in. Thanks to Commonwealth Credit Union for your donations. Thank you for all you do, Dr. Repass, and we appreciate it.
Thank you so much.
Thank you.
Thanks to all my guests this evening, and thanks to you for watching. If you would like to watch this or past episodes again, you can access them through the Family Practice Associates website at fpalex.com. Go to the YouTube channel. Again, thanks for watching and joining us next month for more great healthcare information on family practice.